So, touching a bit more on the medicinal mushrooms, how
Yes.
do you use those? Are those, again, like you said, are they more medical where you're trying to sort of override and help physiology out, or are they more preventative in the whole holistic vet world, or are they both?
Well, I try to go with the evidence because I think that's the best way, the most unbiased way to proceed. And there just is not enough studies in veterinary species. There really aren't enough in human species either, where you measure all the effects. We do know quite a bit about the effects of mushrooms in general, in part due to the research that's been done on the most active component found in medical mushrooms, which are the beta glucan. Now, each individual mushroom, as I'm sure you've explained many times, but each individual mushroom, in addition to the beta glucans, has its own individual organic acids, terpenes, terpenoids, number of different molecules that give that mushroom its specific potency and a specific therapeutic direction. But they all have the beta glucans. And so we do know from a lot of research done on beta glucans, not just derived from mushrooms, but derived from seaweed, derived from grain, derived from yeast. The beta glucans have a wide range of effects. And because the mushrooms contain them, the mushrooms share those many researched effects. What I'm more interested in, though, is the specifics of a given mushroom. Reishi with its triterpenoids, the turkey tail. We have one study, and it's not really that great a study, quite frankly, because it's got such a small sample size, in dogs that had cancer of the spleen called hemangiosarcoma. It's a very, very aggressive cancer, and most dogs don't live 6 months to a year if they get it. Even if they remove the spleen, it usually has metastasized, goes to the heart and other places in the body. It's nasty. But they found when they were using a specific extract of the turkey tail mushroom called PSP, that is derived from one lab in China, that they were able to get survival times. They weren't able to cure them, but survival times was the best they could report. And better survival times in these dogs that got the mushrooms than that had chemotherapy. That was impressive. That got everybody's attention. Now, the consumers in the US and probably the pet owners in Canada as well are, clamoring for that particular extract when their dog gets cancer of any type, although the study was only for hemangiosarcoma. And the company is trying to get that extract patented. They're trying to get it approved by the FDA, and it's quite expensive. I mean, it's almost obscenely expensive. When you can get comparable efficacy, I believe, with high doses of the turkey tail mushroom or with blends of several mushrooms together given at high dosages in order to, because cancer needs a pretty strong shot to affect it. So that's what I do. That's what I did clinically. That's my suggestion to pet owners and to veterinarians, is to use the mushrooms and to use them in a very high dosage in order to improve the response to a cancer of any type, based on this one study and a number of other studies that do show good support for using beta glucans and mushrooms in cancer patients.
I just had a quick question, Dr. Silver. What would constitute a high dose or a range of high dose per turkey tail in your veterinarian practice, or what would that look like in terms of grams or?
I used the same raw materials that are in the real mushroom products from Canadian supplier that are grown USDA certified organic in China. So I took those raw materials and I made my own mushroom blend for veterinary use. And I chose 5 mushrooms, 2 of which are prized edible mushrooms, the shiitake and oyster mushroom, and blended that in with smaller amounts of the reishi, because with pet things, they need to be very palatable. And reishi is very powerful, but very bitter. Not all dogs like bitter, And then I had a larger amount of turkey tail and cordyceps. And then I added a couple of Chinese herbs to that. I did a study several years ago with beta glucans from yeast and found that when I added astragalus root extract and licorice root extract, that I was able to increase the phagocytic capacity of neutrophils that are already being stimulated by the beta glucans in the yeast, but were even better with the Chinese herbs. So we added those to the mushrooms as well. And then we assayed it for its beta glucan content because there are established published dosages for beta glucans. And that's, when you're using a blend of multiple mushrooms, how are you going to figure out how to dose it? That was a good question, obviously. So I used the beta glucan content, which came out to be about 35% in this powder blend, which was highly palatable, and then dosed it that way. And based on a beta glucan expert who's in Kentucky. He's got many, many publications in beta glucans. He has developed some dosing that works. He's done some studies in laboratory animals using different dosages. He found in one study that he did in mice, he used beta glucans. He compared the effect of beta glucans from yeast, from mushrooms, from seaweed on different types of experimentally induced cancers in mice. And then he measured the weight of the tumors as they grew, influenced by each of the different beta glucan compounds at different dosages. And so he found that at about 25 to 30 mg per kg of beta glucans, he was able to get the best inhibition of growth for these aggressive cancers. But for most things, he was using dosages of about 5 to 10 mg per kg. So that's how I established my labeled dosing for that, is based in that. And it may be you're giving them a lot of mushrooms to get that much beta glucan. 40 to 35% is a pretty good assay, and most of the mushrooms that you can get from real mushrooms are in that zone, 25 to 35 or 40%. I think there's one that's even 50% I read recently. So that's how I dose it. And I always try to dose things intelligently, numerically, based on the weight of the animal. I think that's the most repeatable way of doing it, and the most professional way, of course.
Thanks for going through that. That's really helpful. Actually,
complicated, yeah.
But I like the backstory, and I like the milligram per kilogram. It makes a lot of sense if you're trying to just do something effective.
You gotta. We're doctors, you gotta walk the talk.
Yeah, precision. It's nice. It's good.